Keynote address, we have a very distinguished speaker today. We're privileged to have with us one of the two public trustees of Social Security and Medicare, Dr. Charles Blahous. As you know, the trustees prepare the annual report about Social Security, which evaluates the financial strength of the program and its ability to pay benefits into the future. You might not know that besides the two public trustees, the other trustees include the Secretary of the Treasury, Tim Geithner, the Secretary of Health and Human Services, Kathleen Sebelius, the Secretary of Labor, Hilda Solis, and the Commissioner of Social Security, Michael Astor. Dr. Blahous is recognized as one of the nation's foremost experts on Social Security. He served as an advisor to President Bush, as Special Assistant to the President for Economic Policy, as Director of the Bipartisan Commission to Strengthen Social Security, and as Deputy Director of the National Economic Council. After the Bush administration, he joined the Hoover Institution at Stanford University and the Mercatus Center, a research and educational think tank at George Mason. He was appointed to be a trustee of Social Security and Medicare last year by President Obama. Earlier in his career, Blahous was Policy Director for Senator Judd Gregg and Legislative Director for Senator Alan Simpson. You'll note I have described him as Dr. Blahous. He doesn't often use the title, I gather, but I think you'll be interested to learn that he earned his PhD in computational quantum chemistry from the University of California at Berkeley, and his undergraduate degree in chemistry from Princeton, where he had won student honors as well. He is widely published in publications ranging from the Journal of Chemical Physics, the Baseball Research Journal, to the Wall Street Journal. And just last year he published two books, Social Security, The Unfinished Work, and Pension-Wise. Today he will be helping us all better understand the problems that beset Social Security, solutions that have been suggested for resolving those problems, how the solutions will affect today's seniors and younger workers, and how politics appears to be keeping Congress from acting. Following his remarks, he will take questions, so please feel free to take your notes as he speaks and jot down your questions so you can ask them at the end of his remarks. Please join me in welcoming Dr. Charles Blahous.
Well, first of all, thanks again to Stuart and for the very warm introduction. Every time I hear someone review my background, I always think, God, I'm really unqualified to be doing all the things that I'm doing. But I do thank the Beacon for putting this event together. This is such an incredibly important issue, and I really regard it as a great public service to put together a forum. And I think the attendance of so many people today is testimony to just how central this issue is in the lives of so many different Americans. I think I read somewhere once that the Social Security system, more people interact directly with the federal government through the Social Security system than in any other way, with the one exception of the U.S. Postal Service. So it's a very integral part of people's lives. Oh.
Sorry to interrupt. There's a blower in the back half of the room that's making a lot of noise, but there are lots of seats up here in the front, and it's perfectly quiet up here. So if you can't hear, please move up to one of the up front seats. You can hear much better up here. Thank you.
All right. Thanks for not making any cracks about the blower at the front of the room. First of all, I just want to welcome everyone. It's a very important day. It's the first day of the resumption of Eastern Standard Time. And Stuart has promised me that because there's an extra hour, I will get to speak for a full hour and a half before anyone's allowed to ask a question. I'll try to hold off and limit the remarks to about a half an hour. Let me begin by just saying a little bit about who I am and what I do and why anyone would pay attention to anything I have to say about Social Security. As Stuart said, in my day job, I'm a research fellow with the Hoover Institution. I'm also a senior research fellow with the Mercatus Center, and I am one of the two public trustees for Social Security. Now, as Stuart said, there are 6 trustees altogether: Secretary of Treasury, Secretary of HHS, Secretary of Labor, the Social Security Commissioner. And there are 2 public trustees. By law, there have to be one from each party, one Democrat, one Republican. I'll let you guess which I am by the end of the program. But all of the trustees are, in effect, one way or the other, were nominated by the President. Now, obviously, the cabinet officials are nominated by the President to serve in their cabinet positions. And then the other 2 outside trustees also go through the same process. President Obama nominated me last year, and then I was confirmed by the Senate last autumn. And our main job is basically, as Stuart said, to sign off on the financial projections and financial analysis of the Social Security program, most specifically through an annual report that is released every spring. Now this report, I realize I'm biased, but this report is very, very important. It is the primary source of information that the public has, that the Congress has, about the financial condition of Social Security. It's also the only projection mechanism that is specifically sanctioned by the Social Security Act itself. Now, if you follow public events at all, you know there are a lot of agencies around town that do a lot of financial projections. The Congressional Budget Office will do projections for Social Security. The Office of Management and Budget will do projections. But it's the trustees' projections that are enshrined in the law. And they have a very specific relevance to the legislative process. If you go through the budgetary points of order that govern in the Senate and in the House, you'll often see things like such and such is out of order if it would cause the Social Security actuarial balance to change by more than X as estimated by the program's trustees, etc. So we are the arbiters of what's in order, what's out of order, and basically the main arbiters of whether the system is in actuarial balance going forward. Now, why do we have public trustees? Why are there two people from outside the government doing this? Our positions basically have their roots in the 1983 Social Security amendments. Many of you may remember that in 1983 we had, for lack of a better term, a Social Security crisis. We had a period where the program was on the brink of insolvency. We were literally months away from the checks not going out, and there was a major bipartisan accord that was hammered out. It involved all the key political figures of the time: President Reagan, Speaker Tip O'Neill, Senator Bob Dole, Senator Pat Moynihan, the Greenspan Commission, and they hammered out an accord to keep Social Security solvent for the next several decades. Now, what had happened up to that point was that legislators had gotten pretty frustrated. They had to do amendments in 1977 also to make financial repairs. And there had been a concern that the projections coming out of the trustees had been too rosy, that they really had been slanted a little bit, and they wanted to make sure that after everybody sweated blood to get this bipartisan accord, they didn't want to be back at the bargaining table 3-4 years later having to do it all over again because the projections were too optimistic. So basically what they said is, they put in the reforms, we're going to have a Democratic trustee, we're going to have a Republican trustee, and they're basically going to look over the shoulders of the actuaries and the government trustees and substantiate for the public the competence and the integrity and the objectivity of the projections. So that's why we exist, and that's why I do what I do. It's a volunteer position. I'm sorry to say. It's a great honor, but it is unpaid work. Only the government trustees are paid. The rest of us are serving basically in a voluntary capacity. Now, before I get to the substance of my remarks, let me just say that I'm going to quite advisedly and deliberately make my remarks today at a pretty profound level of technical sophistication. And why am I going to do that to you? Well, I'm going to do that to you because, in my experience, I have found that people who show up for events like this tend to be people who have a deep, abiding interest in Social Security. And they really want to know the nuts and bolts of how things are working. They don't want to attend an event and get a bunch of platitudes and slogans and simplifications. So I'm going to basically walk you through a lot of the numbers in pretty arduous detail. And I'm going to do it on the assumption that most of you are here because you really care about this level of detail. Now, if I say something that isn't clear, that requires further explanation, by all means, in the question session, please ask me. Let me just start with one very, very simple message before I get to the numbers. I have one overriding message that I want to convey to everyone in this room, which is that if you are on Social Security, and if you are on the verge of being on Social Security, then this is something that you should want Congress to address as soon as possible. There are a lot of advocacy organizations out there that, in my view, have this all exactly backwards. You see a lot of these organizations coming forward saying, don't touch Social Security, hands off, don't do anything. That is the worst possible advice from the standpoint of the program's current benefits. Is that coming from me, or is that coming from somebody else? Moving. That's not me.
turn up your volume, please?
Okay. How am I doing that? Okay. All right, onward and upward. But the idea that Social Security should be left untouched, left alone, is the worst possible advice for advocacy organizations beginning for the Congress, and it is directly against the interests of people who are now on Social Security and on the verge of being on Social Security. Let me give you a few numbers as to why that's the case. Let's imagine that we do nothing. Imagine that we do nothing until the Social Security trust funds are on the point of absolute depletion, which under our projections will be 2036. At that point, there would have to be benefit cuts across the board of 23%. Now, it's very important to understand this because a lot of people don't get it. They think, well, 23% benefit cuts in 2036. But that doesn't only affect people retiring in 2036. It affects everybody. It affects everybody already on the rolls, including people who are getting benefits today. So it's not something that many people who are in this room are going to want to see happen. And of course, the alternative to that would be a tax increase of a magnitude that there would be no political precedent for enacting. So if you ask, well, we don't want to cut benefits for people now in retirement. We don't want to cut benefits for people already on the rolls. We don't want to cut benefits for that 95-year-old widow who's been collecting for 25 years. So what would the situation be in 2036 if we just wanted to confine the reductions to people who were newly coming onto the rolls? Well, the answer is, in 2036, if you wanted to hold current beneficiaries harmless, even if you cut off 100% of benefits for the new retiree class, the system still wouldn't be in balance. You'd have to cut over 100%. Well, obviously, we're not going to do that either. You start working through the problem backwards and asking, well, how soon do we have to act if we want to have a system that's self-financing, where we don't make changes to benefits that affect people already in retirement, that affect people on the verge of retirement, that affect people on the low-income end, or which depend upon the highest ever tax increase being enacted? When do we have to act? And the answer is just the next few years. Now, if we did act today, it would require some pain in the sense we'd have to adjust current formulas, we'd have to adjust revenues or some combination. But we could, if we chose, we could protect people now in retirement, we could protect people within 5 years of retirement, we could protect people on the low income end, and we could continue to allow benefits going forward to still rise at least relative to inflation. So literally, whether we can protect people who are already on the rolls is strictly a function of how soon we act. The longer we delay, the more we increase the risk, in fact, we increase the certainty that there are going to be adverse consequences for people already receiving benefits. So, in my opinion, the advocacy organizations that are saying don't do anything are giving the worst possible advice from the standpoint of the interests of people now on Social Security or about to. Now, let me give you a few details about the projections themselves. I'm going to start, first of all, with the what, just with the numbers. And then I'm going to get to the why this shortfall is arising and what we can do about it. Last year, we hit a new point in Social Security where the cost of paying benefits for the first time since the early 1980s exceeded the amount of tax income that the program was generating. Now, we long expected we were going to get to that point. We knew we were going to get to that point for years. There have been trustees' reports for the last couple of decades telling us we were going to hit that point. Now, we thought we were going to get it. I shouldn't say we. I wasn't a trustee back then. The previous trustees thought we were going to hit that point in the mid-2010s. And we hit it a little bit earlier. And the reason we hit it earlier, of course, was the recession. The recession depressed incoming payroll tax revenues. There was some increase in benefit claims as a consequence of the recession. So instead of hitting that point in the mid-2010s, we hit it in 2010. And now, under our current projections, we are permanently in a new era where, unless we change something, the cost of paying benefits is going to exceed the tax revenue coming in. Now, let me give you some basic numbers. This year, it costs about $738 billion to pay Social Security benefits. The amount of tax income the program generated is about $587 billion. Now, most of that's from payroll taxes. A little bit of it comes from the taxation of Social Security benefits. So if you just ask, what is the program's impact on the overall federal budget this year, it's adding about $151 billion to the unified federal deficit. That's the gap between what the program is bringing in and what the program is spending. Now, why is that gap so large? Well, it's large in part because, remember, what happened this year is that there was a payroll tax cut for a stimulus program. Congress and the administration cut the payroll tax by 2 points last year. There are proposals on the table to cut the payroll tax even more over the next year. If that hadn't been done, then the gap between the program's tax income and its expenditures would have been about $46 billion. Now, what Congress did at the same time with the agreement of the administration is they said, well, we're going to cut the payroll tax and we're going to make up that revenue from general revenues. We're basically going to subsidize Social Security from the general revenue of the budget. And so they issued a transfer of about $105 billion from the general fund to the Social Security Trust Fund. It was a pure issuance of funds, no taxes coming in behind it. It was just a pure issuance of debt to the trust fund to cover the effects of this payroll tax cut. All right, so when they did that, that made the Social Security deficit about $46 billion. Now, how are we making up the remainder of the $46 billion annual shortfall of income relative to expenditures? Well, that's where the Social Security Trust Fund comes in. Social Security has a trust fund, and it has bonds, treasury bonds in it, and whenever its taxes fall short of benefit payments, it draws on the assets in the trust fund to keep benefits flowing. Now, those bonds earn interest, and this year they earn about $115 billion of interest. And so $46 billion of that is going right out the door to pay benefits to beneficiaries, and the other $69 billion is adding to the balance of the trust fund for the future. So right now we're in a very strange place. On the one hand, Social Security is probably adding about it is adding $151 billion to our broader budget deficit situation, but at the same time its own trust fund is continuing to rise in value. So that's where we are right now. Now going forward, what's going to happen? Well, going forward, of course, what's going to happen is that the cost of paying benefits is going to rise very dramatically. And it's going to rise dramatically because the baby boomers are entering their retirement roles. So we're having a surge in the number of beneficiaries that is already taking place, and it's going to accelerate over the next couple of decades. Now, to give you some perspective, in 2008, before the baby boomers started hitting the rolls, if you were to say, how much of each worker's wages do we need to fund Social Security? How much of each dollar that workers earn do we need to pay for Social Security benefits? The answer then was about 11.5 cents on the dollar. But by the time the mid-2030s come and all the baby boomers are in retirement, that figure is going to rise up over 17 cents on the dollar. So basically we're going to need if we don't change something, we're going to need one out of every $6 that workers earn in order to pay for full Social Security benefits. Now at the same time, of course, Medicare's costs are growing even more rapidly. So if you throw that in, basically we're going to need one out of every $3 that workers earn if we don't change something, simply to pay for those two federal programs alone. Clearly that's not going to work. And even after that point, in 2036, under our current projections, Social Security's trust funds will be completely depleted in 2036. Now remember, Social Security has two trust funds. It has a Retirement Survivors Trust Fund. Basically, it's the Old Age and Survivors Insurance Trust Fund. People think of that as a retirement program. That trust fund is projected to be depleted in 2038. And it also has a Disability Insurance Trust Fund. And that's in much worse shape. And that one is actually projected to be depleted in 2018. Now, if we were to wait until the point of depletion to do something, then basically we would be looking at a choice between cutting benefits by a quarter for everybody, including those already on the rolls, or raising taxes by about a third. If I have a pet peeve as a Social Security analyst, it's when some advocates will say, oh, well, Social Security shortfall is not very big, it's just a nip in the tuck in the grand scheme of things, it's only 0.7% of GDP. And of course, you can make the Social Security look very, very small if you use frames of reference like that. I think it's very irresponsible to do that. You can make anything look very, very small if you compare it to the enormous size of our economy as a whole. But the reality is that from the perspective of people who depend on Social Security, this is not a small problem. You're to ask the typical beneficiary, how would you feel if your benefits had to suddenly be cut by a quarter? They wouldn't think that was a small matter. If you were to ask the typical worker, how would you feel if your taxes had to be raised by a third? They wouldn't feel that's a small matter. And that's exactly the sort of choices we'll be facing if we delay to the point of trust fund depletion. So I think it was a very grave disservice, I think, done to participants on Social Security to try to minimize this when the stakes for individuals are really so high. So that's the what. That's the what. That's where we are, and that's where we're heading. Now, why? Why do we have this shortfall? Well, first of all, let me give you the ridiculously simplified answer first. remember how Social Security works. There's a formula in the law that determines the benefits that people receive. There's also a formula in the law that determines the taxes that people pay. And those formulas don't have much to do with each other. You as an individual Social Security participant, you might get less than you put in, you might get more than you put in. There's nothing that guarantees you're going to get the same amount of money back that you contributed to Social Security. There's no necessary correspondence between the benefit formula in the program and the tax formula, and that is the essence of the problem, because they don't correspond. We have a benefit formula that is promising trillions more in benefits than the revenues that the tax formula would generate. And that's obviously doesn't work. If you promise more in benefits than you collected revenues, then something has to give. So that's the simplified version. Now, why did that come about? Why do we have a benefit formula going forward that is so out of whack with our tax revenue? Well, there's a lot of answers to that. You can make it very complicated. But to make it simple for people, I think it's helpful to boil it down really to three factors. The first is, remember how Social Security is financed. It's basically a pay-as-you-go system. It's not a system where when you pay in while you're working, it's not like an IRA account or 401k account where you put your money in an account and it's saved for you, and then when you retire, you're withdrawing benefits that you yourself paid for. That's not how it works. The way it works is that each generation's taxes go to pay the previous generation of beneficiaries. And the first generation of beneficiaries didn't really pay for their own benefits. They claimed benefits. Their benefits were far greater than any amount they put in. And they were produced predominantly by taxing the generation that came after them. And so on down the line. Each generation came forward, and their benefits were paid for by the generation that followed. So it's not a funded system. It's predominantly a pay-as-you-go system. Now that can work if, and only if, your relationship of contributing workers to recipient beneficiaries is a stable one. If you set up a bunch of benefit and tax formulas that depends on there always being 3 workers to pay for the benefits of each retiree, you're only going to be fine as long as there are 3 workers to pay for each retiree. And that's obviously not what's happening. We had about 3 workers to pay for each beneficiary up until a few years ago, but that ratio is plummeting very dramatically. And of course, it's plummeting because general population aging, but also because of these fertility patterns of our society. We had this enormous baby boom generation born. They're all going on the rolls soon. And then they themselves didn't have as many children as their own parents did per family. And so the ratio of workers to retirees is dropping. Now those are 2 factors. There's a third factor, and it's a little more technical, but it's important to understand it as well. Over the years, there's been a lot of changes to Social Security. If we still had the system that was set up in 1935, we wouldn't have a shortfall now. We would be fine. But there were a lot of changes made to the program over the years that increased what the program was promising. And what happened was in the 1970s, they overreached. And they put in a set of benefit formulas that were not sustainable with our demographics within a stable tax rate. It used to be before all that was done, that over time, as our economy grew, as our tax base grew, as our wage base grew, Social Security gradually became more affordable to our society. And so the economy grew, and suddenly Social Security benefits were all very affordable, and the program was starting to look at big surpluses. And for politicians, this was a great, great thing, because every so often they could enact a benefit increase. They usually did it in even numbered years, and they were big heroes when they did it. But then in the 1970s, that all changed. They set up a bunch of new formulas, and they were not sustainable within projected tax rates. And one of the biggest issues was the way they set the initial benefit formula to be indexed. I'm not talking about the COLA. The COLA is based on CPI. I'm not talking about that. I'm talking about the benefit formula that is used to calculate the initial benefit that each subsequent class of retirees will get. And what they did is they set that to grow with a figure called the National Average Wage Index. And that generally grows faster than inflation. Now, why is that a problem? Well, what it means is that as our economy grows faster, as our tax base grows, our benefit obligations grow at the same time. And so even as we try to get more growth, we can't make any headway in funding Social Security. And in fact, if the ratio of workers to collectors drops, then we can't fund that level of benefits within a stable tax rate. Now, I'm simplifying a bit, but if you just try to remember those 3 factors, you really will understand 99% of why we have a Social Security financing shortfall. Pay-as-you-go financing, demographic changes, and the benefit changes made in the 1970s. If any one of those three factors were not present, we would actually be okay. For example, if we had a funded system rather than a pay-as-you-go system, then each generation would be putting aside enough savings to fund their own benefits, and we'd be fine. Or, if we had a pay-as-you-go system and our current benefit formula, we'd be fine as long as the ratio of contributing workers to beneficiaries never declined. But it is. And, here's the other thing, if, even with our current demographics, and even with our current method of financing, we'd actually be fine right now if they hadn't changed the benefit formula in the 1970s. So you take any one of those three factors out of the equation, we wouldn't have a shortfall. But the three of them together are what caused the shortfall. So that shortfall exists. Now what do we do about it? We have this unfortunate fact, the benefits we're promising and the taxes we're projecting to collect are not matching up. Now someone is going to have to give up something. Either someone's going to have to pay more to fund the benefits that we're promising, or we're going to have to promise less in benefits to fit within the taxes we're projecting, or somewhere in between those two. Well, who's going to have to give up something? Well, the earlier we act, the less likely it is that people already on the benefit rolls are going to have to give something in. The longer we delay, then the more likely it is that when we do make the change, someone already collecting is going to have to give up something. Some poor person is going to have to give up something, and that's why it's important to act soon. Now before I get on to the solutions, I'm going to be deliberately very cagey and neutral about that, and befitting my role as a trustee. I have to be careful in terms of how overtly I express my subjective opinion. But let me just say a little bit about some myths that I think have set back our national discussion of Social Security. One myth that you ought, and this is terrible, I actually saw this in the Ombudsman's article this morning in the Washington Post. Basically, that Social Security doesn't and can't add to the deficit. And therefore, no one should be talking about Social Security as long as we have, in the context of our terrible budget predicament. Now, let me be clear. One can make a very good argument that we shouldn't be talking about Social Security in the current deficit discussion. There's a very good argument to be made that Social Security should be dealt with entirely separately from that discussion. I'll get into that argument later. But the argument that Social Security doesn't add to the deficit is unequivocally false. It's just wrong. This year, Social Security is adding about 151 to the current federal deficit. Now, why is that? The reason is that Social Security is costing more, $151 billion more than it's generating. Now, what's happening, of course, is that Congress is making money available from the general fund to the Social Security Trust Fund. They're basically providing a straight subsidy to the Social Security system from the general fund. But that money that Congress is providing to Social Security is not money coming in the door of the Treasury. It basically shores up the Social Security Trust Fund at the expense of the general fund. And in fact, the vast majority of Social Security's assets in the trust funds actually don't represent revenue coming into the U.S. Treasury. It basically involves things like transfers of interest from the general accounts to the trust fund accounts, or transfers of general revenues, as was enacted this last year. There's a lot of cross-pollination between Social Security's finances and the general budget finances. But the bottom line is that Social Security's impact on the unified budget deficit this year is about $151 billion in the negative. Well, we can talk about that. Well, but I'm happy to talk about that. The other myth is that Social Security, because it's not insolvent until 2036, that means that we're fine until that time. We don't need to take any action until that time. It would be unfair to do anything before then because, after all, everyone has prepaid their benefits up through that time. That's actually wrong, too. The reason that the trust funds are projected to last until 2036 is not because people have prepaid enough money into Social Security to last for a quarter century. Remember how Social Security works. The way the system works is that the vast majority of the money to pay benefits come from taxing the next generation of workers. Not even at the apex of the trust fund, it doesn't come from drawing down the trust fund. So at any given time, the reason that the system is still able to function is not because beneficiaries have prepaid for their own benefits, it's simply because we're taxing the next generation of workers. The peak value of the trust fund, in terms of its ability to finance benefits, we actually hit in 2008. It's about 3.5 years worth of benefits. Now, why is this important? Well, it's important because the longer we postpone reforms, the worse our solutions get, and the least likely we make it that people are going to get what they pay for. It's exactly the opposite of what you sometimes hear people say. If we left everything totally in place as it is, then younger generations, because of the changes that would be needed in 2036, would stand to lose about 4% of their net lifetime wage income to Social Security. That's if they got back everything they're currently promised. That's if we paid every benefit now we're currently promising. They'd lose about 4% of their lifetime income to Social Security. So what happens is you don't get into a situation where you have the fairest relationship between what people put in and what they get out. In order to do that, you have to enact the earliest possible change rather than waiting until 2036. There's a phone going. If I should. All right. Anyway, all right. So the bottom line is that the longer we wait, the worse their outcomes get, and the less likely we make it that people are going to get a fair return on what they put in. All right. Those are the basic sort of facts and figures and myths about Social Security financing. Now, let me give you a couple of views where most of what I've told you, I think most nonpartisan analysts will agree on. What I'm about to tell you is something where I think I'm a little bit more concerned than your average analyst. Let me be clear. I think I'm optimistic in the near term. People who are now on Social Security, people who are on the verge of collecting benefits under Social Security, don't need to be scared. They don't need to be scared yet. We can make our benefit payments in the near term and everything is going to be fine. But I think more than a typical analyst, am very, very concerned about the long-term future for Social Security. In fact, I am now reaching a point where I'm becoming skeptical and pessimistic about Social Security's ability to continue to function over the long term the way that it has in the past. Now, why am I such a gloomy gust about this? Well, I'll tell you. It has to do with Social Security's history. 1983 was the last time we had a major repair to Social Security's finances. Now, we almost hit Armageddon that year. The program was on the brink of insolvency. We were just a few months away from the checks not going out. And both parties agreed on this. Republicans agreed on it, Democrats agreed on it. There was no question it was going to happen. They absolutely agreed on the scope of the problem, the immediacy of the problem, the consequences of the problem. And they still were not, almost not able to reach an agreement to solve it. So 1983, I think, probably tests the limit of the amount of pain and sacrifice that our political system is willing to allocate in order to keep Social Security going on a self-financing basis. Now, let's move forward to today. Why would I be concerned about that history? Well, the Social Security shortfall today, the one we now face, is already much, much larger than the one they faced in 1983. And the reason a lot of people don't understand this is because in 1988, the trustees' ways of measuring the shortfall changed. They changed in a way that makes the program shortfall seem smaller. But if you actually go back and compare the current size of the shortfall relative to our larger economy today, compare it to the crisis they dealt with in 1983, we already have a problem that's over 50% bigger. By the end of this decade, we'll have a problem that's over twice as large. We're basically into a position now and rapidly approaching an even clearer point where there's just no political precedent for solving a problem of this magnitude. Now consider what happened in 1983. In 1983, they had to do some tough emergency surgery to save Social Security. They had to delay the COLA. They had to introduce new taxation of Social Security benefits. They had to accelerate an increase in the payroll tax. They did a few things that we don't have the option of doing anymore because they were already done. They brought all federal employees into the system with all their payroll tax revenue. So they were very controversial choices, very controversial actions. And they were very controversial. ARP, for example, fought them tooth and nail. I mean, the two parties actually had to band together in 1983 to overcome the opposition of the major seniors groups in 1983 to get those reforms to happen. But think about where we are now. Within about 20 years, the magnitude and the severity of the changes we would have to make to keep Social Security afloat in the 21st century would have to be over 3 times as severe just to keep the program solvent, even in the short term, let alone keep going for the long term. Now, at that point, there's simply no plausible likelihood that that's going to happen. There's no political precedent for it happening. In that situation, what's far more likely to happen is they would have to abandon the whole idea of Social Security as a self-financing program, merge it into the general budget, get rid of this separate trust fund idea, get rid of this idea of the program to pay its own way, and start basically financing it from the general fund along with everything else. Now, that I think would be a really tragic thing because Social Security has enjoyed certain procedural and political protections to date because of its separation from the general budget. It doesn't have to compete with welfare. It doesn't have to compete with a lot of things. Social Security gets its authority to pay benefits because of this separate trust fund financing mechanism. So if we tear that down, I think something very dangerous will have happened to Social Security. Now, lest you think that this is an unlikely scenario, consider this. We're already starting to see breaches in the ethics of Social Security as a self-sustaining program. For example, last year when Congress cut the payroll tax, we decided, not we, but the Congress and the administration decided to start funding the program with general revenues to fill that gap. This year, there's a proposal on the table to have another round of stimulus, cutting Social Security's payroll tax even more and subsidizing the program from the general fund even more. This idea that Social Security should be a separate program financed with worker payroll taxes and not part of the general fund is in some ways eroding. Now again, in the near term, I'm not that worried. You're all going to get your benefits. People on the verge of retirement will get their benefits. I don't see this happening anytime in the next few years, but I am very concerned that the dedication to the idea that Social Security needs to stand on its own may be eroding because we're not taking the actions necessary now to maintain that self-financing, and there's already an increased, I think, laxness about making sure that we don't have this sort of cross-breeding between Social Security and the general fund. All right. That's my pessimistic personal take. Before I take questions, let me just give you a few subjective opinions about policy. There's a big question on everybody's mind. And it's, should this joint budget supercommittee that's looking at the overall deficit right now do any Social Security reform? Perhaps disappointing everybody, I'm going to be scrupulously agnostic and non-committal on that point. As a trustee, I try to stay neutral on a lot of these policy questions, but let me tell you, there's strong arguments that can be made both ways. The reason they should do it is that obviously Social Security needs to be reformed. The sooner it happens, the better, and it's unquestionably part of our bigger budget problem. On the other hand, if you oppose this joint committee taking up Social Security reform, there's very strong arguments for that too. Social Security is a long-term program. I mean, we want it to work within its own bubble, if you will, for the long term. The Joint Budget Committee is trying to meet a 10-year target for deficit reduction. And you might think, this is not really the right environment to deal with Social Security, to make changes to Social Security to help this Joint Committee reach a 10-year budget target. And even though, as I've stated, Social Security is a significant part of our larger deficit problem, we really should approach Social Security separately with the idea of balancing its own books and not with respect to hitting any particular target for the general budget. And finally, just taking this on is going to make the supercommittee's job harder than it is. They've got enough difficult things to do without taking on Social Security reform. So there's arguments that can be made either way. I think clearly the substantive imperative is that we have Social Security reform, that we get it as soon as possible, and it clearly is a big part of our fiscal dilemma. But on the other hand, this might not be the right forum for it. You could argue it either way. I'll stay out of the fight. Let me just say that my view is that if putting Social Security reform in with the larger budget discussion helps Social Security reform happen better and sooner, and I'm for that. If separating it makes it happen better and sooner, then I'm for that. If the Joint Committee were to take it up, and if I were asked for recommendations, I would, first of all, do my best to try not to push them in one particular policy direction or the other. But I would strongly caution against continuing the policy of cutting Social Security's payroll tax as a stimulus measure. The payroll tax in Social Security is the program's lifeblood. That's where the program's revenues come from. You cut it, only two things can happen. Either the program goes insolvent earlier, or you have to start propping up the program with general revenues, income tax revenues. And as I said, I think they're both very, very dangerous. It's dangerous to undermine program finances. It's dangerous to support the program from the general fund. And I just have the personal view that we shouldn't be using the Social Security program as a stimulus program. Social Security program, the payroll tax is there to fund Social Security. It's not there to cover for other problems we have elsewhere in the economy. And I'm very, very concerned if the committee decides to embrace proposals on the table to further cut the Social Security payroll tax and funnel more general revenues in the program to compensate for the revenue loss.